Good afternoon. Thank you for tuning in today to our webinar on advanced patient preparation for more on-time appointments. Today, we are going to talk about the upcoming Brightsquid Secure Appointment Reminder service and how it helps you prepare patients in advance with the security that we have included. My name is Jeff McKay. Before we get started today, I do just want to point out, as usual, we have a question panel. If you want to type in your questions in your GoToWebinar control panel on the right of your screen, I will do my best to address them all at the end of the presentation. We were hoping to have Mark Ayer with us today, our Director of Customer Operations, to take us through a live demonstration. Unfortunately, Mark got called to other duties, and so he has recorded a demonstration for us that I will play for you, and let you see all of the features that are included there. So diving in, we're going to talk about automated patient messaging and reminders, obviously. We're going to talk about the different types of patient preparation that you can get by doing this. We'll talk about the outcomes of doing such, and we'll talk about secure appointment reminders and then look at the demonstration. I'm going to try and go pretty fast to get through a few slides at the beginning so that we have a bit of time at the end for questions. So when we look at automated patient messaging or reminders, the point about being secure is that you can include more information for patients. You're not just telling them your appointment as at this time and date. You're telling them your appointment at this time of date is about this issue, and we'd like you to do these things in advance of your appointment to make sure that you're prepared. Clinics, MOAs, other staff, clinicians do a lot of work to prepare for patients. And patients don't really do much to get ready typically. So we've seen, working with other clinics, that getting patients prepared can help with that. So we can create automated messages by appointment type. So you're sending out instructions, and we'll talk a bit about that. Mark will show you how to do that for different procedures that are coming up. You can send by most common communication type. So appointment reminders from Brightsquid will go out through text and email. And you can increase information improves the likelihood of on-time attendance and also helps appointments go more smoothly. So what are we seeing clinics use to prepare patients? So when we look at the messages sent in Brightsquid, we can't read message content, but when we launch templates, so you should be using templates in your account because it saves clinics a lot of time, helps with communication being concise, helps avoid typos and things like that. But what we see clinics sending in templates, because we can see the title of the templates that are being created, procedural preparation. Here's instructions for your upcoming IUD insertion, or your ear syringing, or your colonoscopy, or whatever else procedures might be having patients might be having done in clinic. How to send a photo. So if a patient has an upcoming phone consult, you want to help the clinician have some visuals leading into that phone consult. Sometimes that's helpful. You can send patient instructions on how to make sure that that photo that they're going to send along through secure mail or some service is useful to the doctor. How to use technology. So, hey, we're going to use Zoom for your video consult coming up in a couple of days. Here's what you need to do to get ready so that you can use Zoom properly at the time of the appointment. Readings requests. So we see clinics sending patients messages to say, hey, before your appointment, we'd just like to see your blood pressure, or we'd like to see your blood sugar reading, or maybe even just to check in and see how things are going. Clinics also send instructions for how to get to the clinic, so you don't have to worry about people getting lost along the way. We do see questionnaires, survey forms. Attachments are included in reminders now. Questionnaires and surveys and forms will be built in later. You can still send forms in the form of a PDF or even a text-based form if you want someone to respond to questions sort of in text in a message. This is used for new patient onboarding, any kind of history collection prior to an appointment, complaint investigation and assessment. So tell us more about how you're feeling and why you're coming in tomorrow. And we do have clinics using Secure Mail a lot for COVID-19 screening in advance of appointments. We were talking to a clinic this morning who's 75% of the messages, and they're sending over 1,000 messages a month. So they're sending hundreds of COVID-19 screening messages to their patients before they come in. And what that does for the clinic, we see more on-time appointments. So people are showing up on time because they're a little bit more motivated to show up for the appointment because they remember, oh yeah, this is what it's about. I do still have that complaint. They're better prepared. They're better engaged. We know clinics that send questionnaires to patients about their complaint before the appointment. Patients are more focused when they're in there. They understand what information is relevant. They've had more time to think about their complaint from a relevant perspective. So if they're coming in for headaches, they've had a chance to talk to their spouse about how often do I have these headaches? Do they happen at night? Do they happen in the morning? Do they happen after I eat a meal of pasta? So that they're a little bit more focused and the conversation goes more quickly. A lot of the information is already collected when the doctor walks into that appointment, and they've got their head already sort of pointed in a direction. In doing that, through reducing appointment times, we see clinics increasing access to care. And that means there's more time in the day to address more complaints or to address other complaints a little more fully. We also see through that improved patient outcomes. Now, when we talk to clinics, this is what we hear, and this is talking to hundreds of clinics. 82% of medical professionals agree that collecting patient histories in advance of appointments would allow their clinic to serve more patients by reducing time spent in each appointment. So that's pretty specific, and it fits in with a lot of our goals from a healthcare system perspective. When we think about the quadruple aims of healthcare, we've got patient outcomes, patient access, physician satisfaction and patient satisfaction. So by doing these things in advance, helping patients participate in their care, we're actually advancing care for everybody. 86% of medical professionals agree collecting patient histories in advance of appointments would help clinicians be more effective during consultation. And that comes back to the preparation on both sides. The clinician has an idea of what's going on going into the appointment. They're better prepared, and the patient is able to have a more direct conversation. When we look at results specifically, here's a quote from Dr. Scott Wilson here in Calgary. Preparing patient in advance allows me to deal with their concern effectively and then move on to the next patient more quickly. Using advanced history questionnaires, we were able to see patients in half the time. He actually cut his consult time on some of his patients from 20 minutes down to 10 minutes and was effectively able to double the number of patients he could see in a day without expanding his working hours. So we're going to look at secure appointment reminders pretty soon here. I'm going to play Mark's demonstration video. And just to give you kind of a heads up to frame it, just like regular appointment reminders, it's tied into your calendar. If you're using MedAccess or PS Suite, patients are sent a reminder message to their SMS or their text messaging or email, and that will have a link that can take them to a secure landing page where we protect information about the appointment, those instruction documents, the information about a complaint that would be considered private information you could never send by a regular email or text message. They sign in using their date of birth. It's a quick validation. Attachments are preset by appointment type. So Mike will show you how to set up those reminders and attach them to a different appointment type. So all the content is customizable and in terms of scheduling as well. So for different appointment types, you can decide how far ahead of an appointment a reminder is sent out and which type of reminder it is. Is it a text? Is it an email? And what the content of that message is, and as well as how many reminders, and you can send up to 3 by appointment type. So Mark's going to take us through this. You can show reminder creation, what the secure landing page looks like. We'll see that COVID-19 screening is a form that's built into appointment reminders, so that is something that's there. And look at the dashboard where you can check and see who's got an appointment coming up, who's confirmed it, who's declined. Other things like, hey, have they filled out their COVID-19 screening we asked them to, and have they passed it or failed it? So I'm going to go in here and I'm going to launch the video from Mark, and I will be back as soon as that is done.
All right, thanks. Let's have a look at the Brightsquid Appointment Reminder service. Now, before I jump into the demonstration, I'll warn you ahead of time that I'll be switching back and forth between a couple different points of view. We'll be viewing as a clinic administrator, who for the purposes of today's demo, I'll just call the MOA. We'll be looking at the point of view as to how Brightsquid interprets the upcoming appointments from the EMR. We also may look directly into the EMR to see how things are updating as appointments are accepted or declined, as the case may be. And we'll also be looking at the point of view from that of the patient. So I'll try my best to clearly illustrate who I'm acting as throughout today's demonstration, but just keep in mind those are the 3 points of view we're going to be seeing today. Now, as with the Brightsquid Secure Mail service that you're all familiar with, the appointment reminder service is also a web-based application. Now, there is some integration that has to happen to connect your EMR to the Brightsquid service, but once that connection is made, really everything that you'll be doing with your appointment reminders happens through the web interface. And that's what I'll be spending most of the time showing today. So I'm about to log in here. I'm on the website at panel.brightsquid.com. The actual launch URL might be a little bit different from that. And I'm going to log in as a pretend MOA at a clinic. So let's go ahead and enter the username and password, and that's already done. So I can just log in or sign in, as the case may be. Once I get logged in, this is the configuration panel for setting up my appointments in my appointment reminder system. Now, before I go any further, I should point out a key component of how this service works. We're not setting up reminders to go to specific patients per se. What I'm going to do and what I'm going to illustrate to you now is the process by which I configure an automation to identify patients who need to be reminded of an appointment that's coming up soon of a certain type. That sounds a little complicated, so let me show you exactly what I mean by that. So if I go to my actual appointment reminder configurations, which we call panels internally, these different panels are different configurations for types of appointments that I want to remind or notify my patients of. So let's take a look at this demo test one that I created earlier today. Let's have a look at how it's configured. So at the top of the screen, we just have the name of the reminder configuration or the panel, a description, whether it's currently active or inactive. But the real important part is right here. So this is the configuration, or these are the parameters by which I want to send appointment reminders to patients who have appointments that meet these parameters. Goodness, that sounds complicated, but it really isn't. Let me show you what I mean. So I have an appointment type, and most EMRs, or at least the EMRs that we connect with, allow your clinic to identify different appointment types. Regular appointment in this example, PC appointment, VC. I don't know what all these necessarily are, but these are all different types of appointments that this clinic has set up in their EMR. So the Brightsquid system has identified these are available appointment types, and for the purposes of this demonstration, I've selected appointments of the type regular. Furthermore, who's the provider? The relevant doctor in this situation, as will come as no surprise, are Doctors Brightsquid. We've just named them Doctor 1, Doctor 2, and Doctor 3, and you can see those are all highlighted here. So far, we're going to send appointment reminders to patients who have appointments that are, quote, regular and are with either Doctor 1, 2, or 3 Brightsquid. The last parameter to identify is the time scale. When do we want to send reminders to the patients? 2 days in advance, 3 days in advance, a week, a month, and so on. For the purposes of today's demonstration, I've selected these 3 time periods, so 3 days out, 4 days out, and 5 days out. You can select up to a maximum of 3 notifications to go to your patients, or reminders if you like, um, so that they will be advised and reminded of their appointment in good time. So those are the three parameters that are going to identify when reminders should be sent to a specific patient. Now, keeping in mind that reminders are going to be sent to the patient either to their email address as a regular old-fashioned email, and I'll show you that in a few minutes here when I switch to the patient point of view, or as a SMS text message. Those values, the email address and or the mobile phone number, are being pulled directly from the patient profile in your EMR. So these are not things that are set up in Brightsquid. We're just looking in your EMR to find patients that meet our parameters, and we'll send them appointments on your behalf, or appointment reminders on your behalf. And how those appointment reminders will look are defined here in the lower part of this of the configuration screens. So the message templates, so you can see here the print is kind of small. Maybe I'll zoom in a little bit. You can see here that there's an email notification template, there's an SMS notification template, and then there's also the secure content that they might see as well. So the first two are pretty obvious. These are the actual messages that patients will receive when they're reminded of an appointment, whether it goes to their email or their SMS text message on their phone. They're essentially the same. These templates are customizable, so you're able to type whatever friendly message you like to have in there, perhaps give additional instructions. And again, we'll be looking at all this in just a moment. The secured content of the message, this is quite an innovative part, is because we're sending the messages to the patients through their regular old-fashioned email or through their non-secure text message, the reminders that they're getting to those two channels are fairly generic. You have an appointment at this place, at this address, at this time. Nothing specific about the particulars of that appointment. No healthcare information. However, there's also an opportunity to include a link to ask the patient to go to our secure location, which they'll identify and log into using their date of birth as a password. And then they're able to see the actual secure content of the message, which might say something more specific about the appointment itself. For example, you have an appointment regarding your wart removal on Thursday, whatever date. Don't forget to take a Tylenol before you come. Again, I'm no doctor. That's just an example as to how that secure content might exist. And then lastly, down here towards the bottom, we can identify the channel priority. So whether you prefer to send SMS text messages or emails to the patient. If the patient has both available in their profile, we'll pick whichever one is selected here. In this case, I've selected email as the priority. If the patient doesn't have an email, it'll automatically send or try to send it to the SMS text message. And the last two options down here, this is quite interesting. In addition to just blanket notifying people of their appointments, we can also ask them to interact and respond with specific information. Specifically, we've built an automatic COVID-19 screening questionnaire so patients can answer questions about their potential COVID exposures. Things like, I recently traveled, I've been exposed to COVID, I'm waiting for test results, those kinds of things. The kinds of questions we've all gotten quite used to over the last little while. And finally, I've also attached an assessment form, a self-assessment form, I suppose, that I would like the patient to complete before they come in for their appointment, or potentially bring it with them. So I've now got my appointment reminders configured and they're ready to go. So still remaining within the Brightsquid interface, I can go down to my upcoming appointments tab. You can see here on the left-hand side of my screen, and I can see all of the appointments that we have scheduled in the very near future. So we can see Bob Brightsquid and all these pretend made-up patients with unpronounceable first names. These are all appointments that are coming up in the very near future. They're scheduled, but you'll notice that they don't say confirmed. Well, some do, but most of these appointments that are for next week are just booked, which is the status in the EMR. And the three that I'm familiar with are booked, confirmed, or canceled, declined. So right now, all of these appointments are simply in the booked status because the patient has not yet confirmed that they're coming. But in a moment, I'm going to show you how that looks. In fact, let's do that right now. I'm going to minimize this browser window. And here we have on my screen a sample email notification for one of our patients. So this is Bob. And as you can see, this is the email that Bob has received reminding him of his upcoming appointment on Monday, October 4th, etc., and so on. Again, this is the non-secure email. So it's relatively, well, not relatively, it's completely generic. It doesn't say what the appointment is for. It doesn't hint at any of his health conditions. It's simply a notification that you have an appointment. In order to view the more personal sections of this of the appointment, we ask the patient to view the appointment details via this blue button, which I'll do now. And I'll just maximize my screen here. And to log in to view the actual secure part of the message, I now need to verify my identity. And similar to the way Secure Mail works for registration, we use the patient's birth date for that purpose. So Bob's birthday is February the 8th, 1975. And we go ahead and submit that. And now our patient is viewing the secure component of the appointment reminder. This is where there can be specific information to the patient about what we want them to do. The real call to action is here at the top of the screen, the confirm and the decline buttons. There's also, here's the opportunity to access the COVID-19 screening appointment information. And further down here, we can see things like the specifics of the appointment, the type of appointment could be displayed here as well. And there's also this assessment form that I talked about a moment ago that we're asking the patient to download and fill in and either bring a copy back with them when they come in for their appointment on Monday, or potentially, if they prefer, they can actually log into their Secure Mail account and send that form back through Secure Mail. So there's a lot of opportunity to really prepare ahead of time by having the patients interact and provide as much information as possible. Now, not everyone is going to be willing to do all those things. A lot of patients are going to click confirm and move on, and that's fine. That's likely the situation in most clinics anyhow, where we don't have a ton of information ahead of time. But for those patients who are more, shall we say, tech savvy or of a certain age, it's helpful to get as much information from those folks as we can. So I'm going to do two things here. First, I'm going to do the COVID-19 screening form for Bob here. So I click on the COVID-19 questionnaire. I put in my name. So this is Bob. Remember, I'm acting as the patient now. I should probably highlight that again. So my name is Bob Brightsquid. And let's see, do I have any of these symptoms? No, I don't have that. No, I don't know anything about an outbreak. And I'll just answer no to all these questions. And no, and no. And then I can submit that. I don't have to download a form and email it back. As a patient, I just submit it and I'm done. So now I can go back to my reminder and I'm going to say, yeah, 8:30 on Monday morning, I'm still available. I'm definitely going to be there. Click confirm. I get a notice that my appointment's been confirmed. So as a patient, I'm now done. As I mentioned before, I have the option to complete this assessment form, which I would then download, either print to paper and then write on it, or fill it in as a PDF form and send it back. I'm not going to do that right now because Jeff told me I had to keep this demo short, but that is another option that I would have. So now let us switch back to our doctor's point of view, or the MOA's point of view, I should say, which I believe is this window. And if I go back to my upcoming appointments and I refresh this view, oops, there's the refresh button. There we go. So let me zoom the screen here again a little bit to show that better. So here, this green bar, this is the patient I was just pretending to be, Bob Brightsquid, 46 years old. His appointment with Dr. 2. It's a regular appointment, and he has confirmed he's coming. And this blue icon here, you can notice at the top of the screen, this is the COVID-19 screening column, and he's passed. So there's no red flags. So as an MOA, at a glance, I can immediately see all of my patients' appointments for Monday, October 4th, which are all these ones here if I highlight them. At a glance, I can see who's confirmed, who's passed or failed COVID-19. If Bob had answered yes to any of those questions, this would be a red lozenge or icon or what have you. I can download and view the exact details of what he said, but at a glance, I can tell who's confirmed and who hasn't yet. Furthermore, the confirmed status has changed here, which if we were to go back to our EMR now and view this appointment directly in the calendar for the clinic, this would also show a confirmed status. Now, I'm running out of time, so I don't have, I can't go back and do another patient. Actually, you know what? I think I can. Let me do this really quick. Hopefully Jeff doesn't get too mad at me. So now let's go back to Bob's point of view. And now Bob suddenly gets a phone call that says, hey, we need you to be somewhere on Monday. So Bob notices that he won't be able to make it to his appointment on Monday after all. He can go back in here and change his answer to decline. Have to go to Saskatoon, whatever. Let's do that. So we're changing our answer from confirm to decline. And this is a request to cancel the appointment. Now, when Bob confirmed the appointment, it automatically updates through to the EMR to change the status from booked to confirmed. Declination doesn't work quite the same way because what we hear from most MOAs is they need to be more active or interactive with cancellations. So now when I refresh the screen from the MOA's point of view, you can see here that Bob's appointment is highlighted in red. The patient has requested that to decline the appointment, but the status coming from the EMR is still set to confirmed. So me as the MOA, I now need to go into the EMR and actually cancel that appointment to free up the time slot for someone else to use. The advantage of that is I might want to phone Bob and say, hey, do you want to reschedule for Tuesday instead? Also, in a very busy office, which I'm sure most of you are, when a time slot comes available, I've got a wait list of patients who may want that appointment. So it's really important that we interact with these cancellations directly so that we can reach out to the patients on the wait list and fill this slot so that we're still busy on Monday and we don't sit around on our hands for 10 or 15 minutes, which I know never happens in any of your clinics. All right, so I'm going to wrap up here really quickly and hand it back over. One couple things I wanted to show is in the logs file over here on the left-hand side, we can see all of the appointment reminders that have gone out recently. So we can see in the last couple of minutes, actually, just while I was talking, we can see that things like this one to Bob went out. We have another patient named Vladimir. Looks like Bob got another appointment reminder. We have a lot of tests going on here. This is just my view of appointment reminders that have gone out and which channel they went out through. And then here in the templates section, this is where I actually write those messages that my patients are going to see, either in an email or in a SMS message, or the secure content that the patient only sees after they verify their identity and log in. So that's the appointment reminder service in a very short nutshell review. I hope that that answered some questions or maybe put some new questions in your head that you would like us to answer now. So with that, I'm going to wrap up my little demonstration here and turn it back over. Thanks very much for your kind attention.
Thank you for your attention there. Hopefully that was helpful in getting answers to your questions about how the service works. Just to note, we will be sending this recording out to everybody who registered. So I know not everybody is able to make it during the lunch hour during the day, but we will send this out. So it is referenceable. The only real question I have here is that how do we sign up? So there is right now sort of we have a number of clinics that are testing appointment reminders, making sure that we've got everything worked out, make sure that it works properly, and then as expected, and collecting any feedback on tweaks we can make to the service. So you can sign up to use it right now to connect into your MedAccess or PS Suite EMR. This is the way to do that on the screen. So if you go to brightsquid.com, under the Secure Mail tab at the top, there is an appointment reminders button that you click on there. It will take you to a page that has a form to submit a request to join the appointment reminders program. Appointment reminders right now, anybody who joins the program at this stage, it's free. And then after that, once we launch the product in full very soon, it'll be available for a subscription fee. So if there are no other questions, we'll end things a little bit early and let everybody get back to their day. And thank you so much for your time. Feel free to get in touch with myself at jeff.mckay@brightsquid.com or mark@brightsquid.com if you would like to explore this any further. Thank you so much and have a great rest of your day.